Cancers can appear at first as innocent marks on the face. Taking care of them in a timely manner is very important. Dr. Jonathan Berman of Boca Raton Community Hospital joins us today to answer your questions about facial cancer. Good afternoon. Thank you so much for your time today. We really appreciate it. Let's start with a basic question. Exactly what is facial cancer? It's
a skin cancer for the most part.
Is it? And there are different types of skin cancer, aren't there, Dr. Berman?
Yeah, there's three predominant types.
What are they?
Basal cell carcinoma, squamous cell carcinoma, and malignant melanoma.
Which is the most serious?
Malignant melanoma.
And are all of them primarily caused by sun damage?
For the most part, yes.
So let's just bottom line that one right away. We should all be wearing a nice sunblock and a hat most of the time in South Florida, shouldn't we? When I say nice, meaning a heavy SPF.
Yep.
What is a facial flap? One viewer is calling to wants an answer to that.
It's a piece of tissue that is from the adjacent area from where next to the skin cancer. So when you cut the skin cancer out, you kind of move the tissue that's adjacent to that area.
Does that have to be removed as well down the road, or?
Not usually. It's cancer-free skin.
How is it determined that one is a candidate for facial reconstructive surgery after some type of cancer removed from their skin?
Well, most people are. Most people, if there's a skin cancer and it's excised, there's usually a hole. And you have to close the hole. So the hole can be real small or it can get pretty large.
What are the best ways to do that reconstructive surgery?
The best ways? It depends the size again. If it's real small, you can usually move the tissue that's right next to it to close it. If it's a little bit bigger, you have to create a small flap, sometimes a larger flap, and if it's a big hole, a very big flap.
We have a couple questions about oral cancer. Oral cancer is a little bit more predominant than we hear about, isn't it?
Yes.
One person said, I'm discussing options about my oral cancer with my physician. I'm terrified of being deformed. So should plastic surgery be a part of my surgical team?
Not necessarily all the time, but it depends how large it is. Basically, a lot of times, if it's a very, very small cancer, it can be closed primarily, and it can be taken, and surveillance is important. So the sooner you find something, the easier it is to treat, and the smaller it is, the easier it is to close.
So this viewer should talk with her surgeon who's removing the oral cancer about how big it's going to be, and if in fact she does need a plastic surgeon, and what they're going to do after the cancer's removed?
Sometimes. I mean, a lot of times there's some fine head and neck surgeons that can take the tumor out and close it without needing a plastic surgeon.
Another viewer says, I have that Cindy Crawford mole. This is the viewer's word, and says, should I have that removed?
Well, it's a mole. Moles are benign. What we usually encourage people to do is to watch their mole. If it starts changing in color, size, or its character, then see a dermatologist. As such, then maybe a biopsy is needed to see if there's some kind of malignant transformation.
Oh, thank you so much for your time, Dr. Berman.
Sure.
We appreciate it. Dr. Berman is sponsored by Boca Raton Community Hospital, and Boca Raton Community Hospital also underwrites our Ask the Doctor segment. We're back with more in just a moment.